welcome. On behalf of the faculty and staff of the Yale School of Public Health, my deepest and most heartfelt congratulations to the class of 2024. What a celebration for all of you and for the loved ones who have helped us along this journey. I am so grateful to see so many of you here joining us, either in person or on the live stream, to celebrate with your graduates. And I have to say, this is my first Yale commencement and my first as Dean of the Yale School of Public Health. So this is a particularly special moment and celebration for me. Before I go further, I, in Yale University, also want to acknowledge that Indigenous peoples and nations have stewarded through generations the lands and waterways of what is now the state of Connecticut, where we stand today. These include Mohegan, Mashantucket Pequot, Eastern Pequot, Schaghticoke, Golden Hill Pocasset, Niantic, and the Quinnipiac and Algonquin-speaking peoples. We honor and respect the enduring relationship that exists between these peoples and nations and this land, and we're privileged to be on it today. You guys can sit, by the way, sorry. This is my first commencement, so I forgot to tell you to sit, I apologize. And I should say that as I was prepping this talk, I had no idea what the traditions were here. Was I supposed to give some sort of big flowery speech or just offer platitudes about how proud we all are of our graduates and what a celebration this is? But as I was worrying about what I should do, I realized that for you, our graduates, this is your first time graduating from the Yale School of Public Health too. So I figured this is as good a time as any to start some new traditions. And to me, the point of tradition is for it to facilitate hope, community, and humanity. Tradition should be a way to pass on wisdom and set you up for success. So I thought I'd start by sharing 3 hard-won lessons that have helped to carry me through, and I hope will serve as a guidepost for you as you leave our halls and start your careers as public health professionals. The first lesson is to follow your North Star. To our graduates, I'm going to ask you to close your eyes for a moment and think back to when you first submitted your application to the Yale School of Public Health. Why did you apply? What drove you to pursue this degree? Now, think about where you are today. Open your eyes and look around, and I'll bet that even if the path that you took may have taken you a little bit offsides from that original topic, the underlying motivation is still the same. For me, I entered public health for 2 reasons. First, because I believe that health is a human right. And second, because I believe that the structures in which we work, live, and play matter more than the individual care that I could ever provide to patients as a physician. For those in the audience that don't know me, I'm also an ER doctor, and I love being an emergency physician, but I hate sending people back out into the same system that made them injured or sick in the first place. That North Star is what has driven every aspect of my career, including my decision to come here to Yale. And I invite you to keep that North Star, that vision that you had with your eyes closed, close, no matter what it is, over the course of the rest of your career. Which brings me to my second lesson: use data. If I go back to my start as a violence prevention researcher, I could have been just an activist, and there's nothing wrong with that. But I can promise you that more is possible by combining a passion and North Star with data and research. We've made progress on preventing firearm injury, not just by talking about it, but also by gathering and sharing facts, whether on the epidemiology of injury, by gathering and analyzing the qualitative data that humanizes the problem, or by evaluating the effectiveness of policies and structural change. And you, our graduates, can do the same. You are graduating from the Yale School of Public Health with the ability to gather, analyze, and accurately present data. That is unique and something that you have thanks to being a public health graduate from Yale. Please use these skills. We need them, and they make a difference. Which leads me to my third lesson: be an incorrigible optimist. Someone once told me that the biggest marker of being a great leader is believing that a better tomorrow is possible and then creating a path to get there. Or, as Supreme Court Justice Ruth Bader Ginsburg once said, fight for what you believe in, but do it in a way that will lead others to join you. And if the history of public health teaches us anything, it's that optimism, that fight, the belief in us joining together is not just possible, but warranted. I know you are graduating at a time of unprecedented crises across the globe, for public health, for geopolitics, for communities. You joined us during COVID. You're graduating into worsening climate change, war, humanitarian crises, decreased trust in science, uncertainty about what the months and years ahead will bring. It is possible to feel hopeless, but I hope that you will reframe it into a message of possibility. You, our graduates, more than anyone, have the potential to create change. Public health is at its core a story of optimism. It is thanks to our science, our action, and our humanism that global AIDS deaths have decreased by more than 90%. US car crash deaths per capita have decreased by 70%. Smallpox has been eliminated across the globe. Childhood lead poisoning has become an anomaly in the United States, and I could go on. These successes that we barely appreciate today are all thanks to public health. And you, graduates, are the next step in that optimism. You were admitted into the Yale School of Public Health, no small feat. Not only that, you've completed your degree, also no small feat. You've put in untold hours of sweat, tears, and computer coding. And I hear you like biostatistics, thanks to Professor Winninger. You've shown determination and resilience, and you've hopefully made some lifelong friendships. I also know that you have all completed some kind of applied practice experience, so kudos for that. You have all the skills you need. Graduates, I have confidence in you. Everyone sitting on this stage, all of your professors and mentors, we have confidence in you. And your loved ones filling this hall today, they have confidence too. So I hope that if you take nothing else away from today, from your mentors, from your fellow students, it's this: if you follow your North Star, the commitment that brought you to our doors, if you collect and responsibly use data to illuminate the underlying causes of health, and if you remain an optimist who believes that a better, healthier tomorrow is possible, you will be not just good, but great. Looking to the future, I am confident that this graduating class will use data, stories, and passion to transform those systems and structures that determine health in ways that we, your teachers and community, can't possibly imagine. Congratulations. And it is now my immense privilege to introduce our distinguished 2024 commencement speaker, Dr. Céline Gounder. Trained at Princeton University, Johns Hopkins University, the University of Washington, and Harvard, somehow missing Yale along the way, Dr. Gounder is an internationally renowned epidemiologist and infectious disease specialist. She's also a clinical associate professor of medicine and infectious diseases at New York University's Grossman School of Medicine. Relevant to our topic today, she's one of the world's leading experts in science, medicine, and public health communication. Dr. Gounder is currently a senior fellow and editor-at-large for public health at KFF and KFF Health News. She's also a CBS News medical contributor and is CEO, president, and founder of Just Human Productions, hosting 2 podcasts, including American Diagnosis and Epidemic, which I encourage you to check out if you're not familiar with them. Dr. Gounder also advises local and national policymakers on issues of public health, including epidemics and pandemics, the health impacts of climate change, mental health, drug overdoses, and disinformation. She's honestly been part of the solution to every major health crisis of the last 2 decades, ranging from Ebola to TB to HIV to opioid use disorder. She's also a dear friend, and we've known each other for a long time, but got to know each other even better during the COVID pandemic, when we had each other on speed dial as we were trying to figure out how best to help our communities, the country, and the globe. And it's an absolute honor and privilege to welcome Dr. Céline Gounder today. Céline.
Thank you, my dear friend, and good afternoon to all of you today. Dear graduates, you have the great honor of being the very first class to graduate during this important moment of transition in the school's history. You also have the honor of entering the public health workforce at one of the most challenging times in the profession. The American public understands and values public health less than ever. Public health officials on both sides of the aisle are loath to consider public health policies that might be construed as limiting individual freedoms or having an impact on the economy, or perhaps their chances in the upcoming elections. Public health authorities are being curtailed, and the public health problems that lie ahead, such as more epidemics and pandemics, and the health impacts of climate change, will be even more politically polarizing and difficult to solve. I have some serious COVID PTSD. I had very high hopes for us coming out of COVID. I thought Americans might finally understand the need to invest consistently and for the long term in public health, that we'd understand health security as part of national security, but the nation hasn't. Today, I feel the same unease and queasiness and fear that I felt in January and February of 2020, when I'd refresh the Johns Hopkins COVID dashboard over and over and over, looking to see where the virus was spreading next. We were like sitting ducks, the virus marching from China to Iran, Italy, the UK, a cruise ship, a nursing home in Washington State, and then New York City, where I live and work, became COVID ground zero. Every time I hear an ambulance siren, I think back to March and April of 2020. The eerie silence of the city, punctuated by so many sirens, much as the silence on hospital wards was broken only by code blues on the intercom. I still can't walk to Bellevue Hospital without picturing the mortuary trucks parked across the street. I remember the care with which I'd suit up in fresh scrubs every day, a cap over my hair, a mask on my face, and then the care with which I'd strip it all off at the front door of my home before jumping in the shower, and then working a second and a third shift, counseling public officials, giving media interviews, drinking from the science, policy, and news fire hoses. My personal life went on pause, not for months, but years. Why am I having COVID flashbacks? When H5N1 avian flu doesn't seem to be a real threat to the general public right now. Right now. I feel like I'm watching a train wreck in slow motion. With COVID, the crash took weeks. With H5N1, yes, maybe it'll take years, but that doesn't make it any less painful to watch. In some ways, it's even more painful because this time, we might actually have more time to act. But Americans are just so over it. Most of the public doesn't want to remember and learn. Americans just want to move on. During the initial months of the COVID pandemic, China's response was marked by significant missteps. Crucial information was withheld from both the public and the international community, delaying a global response. Doctors first started piecing things together in late December 2019. It wasn't until a couple days later that the China CDC learned of a possible outbreak. And though genome sequencing was available in late December, it wasn't shared with the world until mid-January. A Chinese researcher sharing the sequence with a Western colleague to get it out there. Meanwhile, whistleblowers like Dr. Li Wenliang, who tried to raise alarms, were silenced. And the severity of the virus was downplayed. This lack of transparency was driven by a desire to maintain economic stability and control public perception, and severely hampered timely containment measures. And the virus spread more widely and quickly than it might have otherwise. With this current H5N1 avian flu outbreak, dairy farmers and vets observed dairy cows producing dark milk as early as January. Had milk samples been sent for the same kind of genomic sequencing performed by the Chinese on COVID specimens in December 2019, we might have understood what we were dealing with in January of this year. But instead, it took several weeks before appreciable data was shared. And even then, it was raw data, stripped of dates and locations. That data showed that bird flu probably jumped into cattle in late 2023 or early 2024. This outbreak is already several months old. We missed the opportunity to prevent bird flu from spreading widely among dairy cattle, worrying consumers and harming the dairy and cattle industries. Although no infectious virus has been found in pasteurized milk available for sale in retail stores, some members of the public have stopped buying milk. No infectious virus has been found in ground beef thus far either. But perception can be reality. The industry has already taken a financial hit, with affected dairies taking as much as a 20% hit to their income, and US cattle prices dropping as traders fear the outbreak could hurt demand. Long before the COVID pandemic, infectious disease experts like me have worried about the possibility of an influenza pandemic. The 1918 flu pandemic, which is estimated to have killed 50 to 100 million people worldwide, is one of the deadliest in human history. H5N1 flu viruses have long given us pause, our leading candidates for the next big pandemic. They were first detected in poultry in China in 1996 and quickly spread throughout the region. But poultry farmers were resistant to culling H5N1 infected chickens to stop the spread because they weren't indemnified for their losses. Infected birds continued to spread the virus around the world, eventually infecting poultry in the US starting about 2 years ago. The H5N1 avian influenza virus is deadly to birds, and it's estimated that the mortality rate among humans may be over 50%. So when we learned that H5N1 avian flu had spread to dairy cattle and other mammals, it was cause for concern. Fortunately, H5N1 avian flu doesn't seem to kill cows in the way it does other mammals and birds. Only one human case of bird flu has been confirmed so far this year in the US, and it was mild, though perhaps many more are flying under the radar. Bird flu may spread through the entire American cattle and dairy industry, becoming endemic. But here's the thing. As the virus infects and replicates in cattle and other mammals, it's mutating and adapting. We've never seen such a diversity of mammals infected before. Not only birds and cattle, but also cats, goats, foxes, dolphins, sea lions, and many more. Infections in each of those hosts represents an opportunity for the virus to evolve and better infect humans. Already, the bird flu strain that infected the dairy worker in Texas had a mutation that's a step towards mammalian adaptation. It's concerning this mutation appeared so quickly. And because humans come into closer contact with domesticated animals than other mammals, the risk of transmission to humans is higher. What worries me isn't that people will get H5N1 avian flu from drinking pasteurized milk or eating beef. It's that the H5N1 avian flu virus will evolve to spread from person to person, causing a pandemic as bad or worse from the one from which the world is currently emerging. This could take years to happen, but there's a lot we could be doing now to prevent and prepare. We don't understand how quickly or how the H5N1 avian virus is evolving, unless we broaden our surveillance, not only among dairy cattle and other domesticated animals, but also among other mammalian hosts. We're flying blind. No, I don't think we've got another pandemic on our hands, not now, not yet, but at some point down the line, quite possibly. It's a slow-moving train wreck. We could do something about it, but will we? Earlier this month, the Biden administration announced new programs to incentivize dairy farmers and workers to collaborate with public health efforts to investigate and mitigate the H5N1 avian influenza outbreak among dairy cattle. Farmers and agriculture officials have called such testing overreach, telling public health officials to back off. Farms don't want to be identified as H5N1 hotspots for fear that they might end up with milk or beef they can't sell. While just a start, the Biden administration's new programs are a first step towards creating the trust and collaboration between public health and industry, and herein lie some important lessons for you as you join the profession. The USDA will begin compensating dairy farmers whose cows are infected or need to be taken out of milk production, but to qualify for such compensation, dairy farmers will have to agree to participate in enhanced epidemiological surveys and other public health measures. In addition to compensating for lost milk revenue, the USDA will provide up to $28,000 per farm to support various biosecurity measures, including heat treatment of contaminated milk prior to disposal, veterinarian costs, and lab testing. It's unclear how the USDA will calculate compensation for lost milk revenue. Dairy farms vary tremendously in size, from under 100 cows to more than 15,000. Thus far, it's mostly the large farms that have been affected by H5N1 bird flu. And compensation proportional to the number of cows to be tested might be more persuasive. Dairy milk processors and retailers could also be motivated to ensure that the farms from which they source their milk are cooperating with public health officials on surveillance, testing, and mitigation measures. Consumers, all of you, have a role to play here by demanding that retailers source their milk from farms that are cooperating with public health authorities. Other forms of industry support may also be needed. If contaminated milking equipment is found to be an important vector for transmission, farmers may need to be incentivized or compensated to purchase more milking equipment and hire more farm workers to maintain the same throughput while allowing for time to sterilize equipment between cattle. Currently, only 5 minutes is allocated to milk each cow, and they need to be milked 2 or 3 times a day. It's also unclear why an indemnity program didn't already exist for the dairy industry. Poultry farmers are compensated for poultry when they're forced to cull them due to H5N1 avian flu on their farms. However, these programs have been criticized for subsidizing highly profitable, big commercial farms without putting pressure on them to do more to change farming practices that may lead to more infectious disease transmission. This is a moment for the USDA and other public health agencies to step back and take stock of whether other risks may exist across the agriculture industry, what incentives may be needed to encourage cooperation with public health officials in the future, and how the industry can also be encouraged to mitigate risks now. In addition, the CDC will compensate dairy farm workers $75 for participation in epidemiological studies of H5N1 avian influenza. As of last week, there have been no takers. It's unlikely that $75 will incentivize many dairy farm workers to participate. It's a notoriously exploitive industry. The working conditions on dairy farms are grueling and dangerous, with very few Americans willing to take those jobs. Most milkers are foreign-born Hispanic workers, many of whom are undocumented and don't have health insurance. Many speak indigenous languages, not Spanish, much less English, making it even more difficult for them to report health and safety violations and access healthcare and social services. Many can't access health facilities because there isn't good public transportation in rural areas, and they can't get a driver's license in many states. The risks of their work are normalized, and many don't understand that there are ways to reduce and prevent injuries. Despite various chemical and biological risks, including not only H5N1 avian flu, but also exposure to formaldehyde, chlorine, Q fever, and antibiotic-resistant bacteria, it's uncommon for dairy workers to wear masks or goggles. And even if they understand how to report unsafe working conditions and living conditions, dairy workers are excluded from protections under the Fair Labor Standards Act, Migrant Seasonal Agriculture Worker Protection Act, and the Occupational Safety and Health Act. Workers who take time off for being sick may be punished with loss of income, housing, and their job. And because few have a pathway to legal status in the United States, for many, their greatest fear is of being deported. They do not want to come to the attention of any government official. Even the one dairy worker in Texas who we know had H5N1 avian flu refused follow-up testing, and his close contacts also refused testing. President Biden has used his executive powers to grant work permits to migrants newly arrived in the country, and many farmers support providing work permits to undocumented farm workers to help address labor shortages. In the absence of legal protections, paid sick leave, and at least temporary legal status in this country, it's unlikely many dairy farm workers will be willing to participate in research to protect American public's health. Many questions remain. We still don't understand the overall risk to farm workers. Based on prior human infections, again, it's estimated that the mortality rate among humans may be over 50%. We don't know what proportion of farm workers and cattle may already have been infected, and whether prior infection is protective against future infection with H5N1 avian flu viruses. We don't know how the virus may be mutating with each infection and adapting to human hosts or becoming more transmissible, more virulent, or more resistant to existing antivirals. We don't know if the virus is spreading only through contact with milk or also through the air. We don't know if wearing goggles and masks will reduce the risk of H5N1 avian flu infection among dairy farm workers, or if other measures like better indoor ventilation and air filtration or disinfection of milking equipment might be more effective. In the long term, vaccination of dairy cattle, other domesticated animals, and farm workers may be an important measure to control the H5N1 avian flu outbreak and reduce the risk of the virus evolving to spread person to person. But there is concern that farmers may not want to use H5N1 bird flu vaccines because of the potential impacts on their ability to export cattle, beef, and dairy products. H5N1 flu vaccination is unlikely to prevent all infections in poultry or cattle, but could mitigate disease severity and curb, though not eliminate, transmission. The USDA and other countries restrict importation of animals and animal products where there's been vaccination against avian flu, foot and mouth disease, and other such infections. You can imagine there might be some tit for tat. And will farm workers line up to be vaccinated where there's not a lot of trust? One of the lessons of the COVID pandemic should have been that controlling an infectious disease isn't just a question of having diagnostic tests, treatments, and vaccines. It's also about creating systems that allow people and industry to do the right thing for their own health and for public health without having to take a hit, whether that be losing revenue or wages, jeopardizing a job, or risking deportation. The H5N1 avian flu outbreak needn't be a rerun of COVID's public health versus the economy. There's a lot at stake for the US and the rest of the world. No one wants the US dairy industry to become a Wuhan wet market for the next global pandemic. I don't want you to take my comments today as cynical or a form of public health doomerism. The last thing we should say is why bother in the face of déjà vu or big problems? Understand the perspective of other stakeholders whose first priority may not be public health. whether they be undocumented immigrant farm workers afraid of being deported, or the dairy cattle industry worried about their bottom line. American consumers anxious about unknown risks and resistant to paying more for groceries, or even partner trade nations that may be looking at the H5N1 avian flu outbreak with a wary eye, ready to ban imports of American poultry, dairy, and beef products. We need to think creatively, not only about biomedical and technical solutions, but more importantly, systemic, structural, and political solutions too. It's about the allocation of scarce resources and competing interests and values and peoples and histories and cultures. Public health is political. I hope that you'll all come to see how the public health approach to broaching divisive issues can serve as a template for how to listen, and debate and partner respectfully and productively, whether that's vaccine skepticism or gun violence, or balancing public health and economic concerns, or dare I say, the tragedy unfolding in Israel and Gaza, Gaza and Israel. Learning how to navigate the political with grace may be the greatest challenge of your careers. Good luck, and make us proud.
If you ever needed motivation for why you studied epi of microbial disease, hopefully it happened right there. Thank you, Céline. Truly a joy to listen and an inspiration. So now it gives me great pleasure to introduce our second speaker, Kamali Clora. As you can tell from the audience, Kamali was chosen by his peers to deliver this year's student address. Kamali, I'm going to embarrass you for just a second and do a little bit of an intro. Kamali's origins in public health and healthcare started as a CVS health technician when he administered COVID-19 vaccines in the Detroit metropolitan area during the pandemic. He then served as a patient access specialist in hospital radiology, ensuring that patients received timely diagnostic testing, getting that bird's eye view into the degree to which access determines health. These experiences drew Kamali to the health management field. He did an administrative internship at Mass General Hospital and then brilliantly decided to come down 95 to us here at the Yale School of Public Health. During his time at Yale, Kamali has not just been an exemplary student, but has also contributed to the community in other ways. He served as one of the executive directors for the Haven Free Clinic, where he led the provision of care for more than 600 uninsured patients in the greater New Haven area. He's had the privilege of serving his student community on the Presidential Search Committee Student Advisory Council. No, I have no insight into what's happening with the presidential search. And he's also served as a teaching fellow for 3 courses across the School of Management and YSPH. Kamali's internship at the Mayo Clinic this past summer reinforced his decision to pursue an administrative fellowship, leading him to continue his journey next at Northwestern Medicine. Personally, it has been an absolute privilege to get to know Kamali and many of you over the last year, and I can't wait to see what you're going to do next. Kamali, the stage is yours.
Pressure. Wow, it's packed in here. It goes to show you how loved you all are, so take that all in. First, want to say good afternoon, Dean Ranney, friends, family, faculty, and staff, and honored guests, and fellow graduates. Or as we would say in Detroit, what up, though? Thank you all for being here today to celebrate this remarkable milestone. Can we give a round of applause for the people who have helped you get to the seat you're sitting in today? Now, before we dive in, I would like to credit ChatGPT for writing 90% of this speech. I only wrote the greeting. Kidding. No, I'm not. As I'm on this stage, I think back to the reasons why I chose the path of public health. I remember my family moving from Detroit to a suburban area outside of the city, and I was young at the time, but I recall the stark differences in the racial demographics and urban development of this new, more affluent town. It amazed me that two places just 30 miles apart seemed worlds away, and it wasn't until I had my first public health course in undergrad that I began to put this into perspective. These two disparate communities had a difference of 15 years in life expectancy, a result of the infrastructures at play doing exactly what they were designed to do: neglect. Where you and I see injustice, others see wealth and opportunity. It was this realization that propelled me into the field, specifically down the rabbit hole of healthcare. As I interacted with patients during pivotal junctures in their ambulatory care journey, many of them described healthcare as having winners and losers. It makes me reflect on the words of the late Dr. Paul Farmer, who once asked, "If access to healthcare is considered a human right, who is considered human enough to have that right?" This question embodies the very essence of our education at YSPH. It reminds us that true progress in public health means leaving no one behind, and that we must dismantle the barriers that perpetuate disparities at home and abroad. This is a societal responsibility that can only be achieved through collective action endeavors. When talking about healthcare in this country, our conversation should never just devolve into just pills and procedures, but policies and partnership. We must untangle the complex web of socioeconomic factors that influence health, and no discipline can do this alone. As it's told in the African proverb, if you want to go fast, go alone. If you want to go far, you go together. Public health works best when we build bridges across sectors through a health and all policies approach. Now, humor me for a second. By show of hands, when you were asked as a child what you wanted to be when you grew up, how many of you said, "A public health professional"? Me neither. And for the parents here who don't understand what the heck you're gonna do with your degree and why it matters, in the past century alone, public health advancements increased life expectancy in the US by more than 25 years. Incredible, right? Keep listening. Yeah. Thanks to these folks up here. Public health fundamentally hinges on addressing social determinants of health, and those are the non-medical factors such as food security, transportation, safe housing, etc. 80% of our health outcomes are driven by these social determinants of health, but less than 5% of our total national health dollars are spent on public health activities. This is just one of the unacceptable paradoxes we must grapple with, where there is not only a lack of commitment to keeping people healthy in this country, but an absence of investment commensurate with that cause. The work we do is often thankless and underfunded, but is a rewarding profession of service. Public health is not merely a career, it is a calling. We are tasked with improving the health and well-being of entire communities, tackling systemic inequalities, and facing irascible challenges that plague our society. Now we are needed more than ever, as we have witnessed the far-reaching effects of politics and power on the very fabric of our work. We have seen science twisted and contorted to fit political agendas, leaving truth and evidence trampled in its wake. On top of this, we inherit a world where war, genocide, and racism persist. A climate crisis that for some reason is still under contention, where there are policies that criminalize women and transgender people's bodily autonomy, and where health outcomes are too often determined by zip codes. But I stand here today not to dwell on the problems, but to ignite the flame of leading with a healthy disregard for the impossible. Public health needs bold, empathetic, visionary leaders like us who are unafraid to disrupt existing paradigms and zealously forge new paths that ensure the conditions where every individual can enjoy a prolonged, healthy life. Throughout our time at Yale, we have been blessed with extraordinary opportunities to collaborate, learn, and grow as individuals and as a community. Replete with these tools, we are poised to become the change agents that our communities, our nation, and our world desperately need. And as we find ourselves in the inevitable flow of change, we possess the competence to lead that change. But remember, leadership is not confined to titles or skill sets. It's a commitment to constantly challenge the status quo, even when it feels uncomfortable, unpopular, or bureaucratic. American economist Peter Drucker said that management is doing things right. Leadership is doing the right things. Leading change does not come from the luxury of complacency. It stems from one powerful word: courage. Courage to examine our own complicity in systems of oppression, courage to listen to those whom you disagree with and finding compromise, and courage to wake up every day and not see the world as it is, but as it ought to be. For it is easy to become overwhelmed by the magnitude of these issues and succumb to cynicism. Yet I urge you to not get lost in the statistics and deficit framing, for behind every data point lies a human story. The work we do is deeply personal, and it is these stories that should fuel our drive to be catalysts of transformational change, unwavering advocates for evidence over misinformed ideology, and amplifiers of marginalized and disenfranchised voices. It's our obligation to stand up for those who are not in the room and can't represent themselves. You know, this degree grants us a debt. And I'm not talking about student loans here. Although we have more than enough of that. I speak of the debt to your community. We owe our community our ears, our skills, and our voice. So be less concerned with who you have to stand up to and more concerned about who you're standing up for. You are, in so many ways, someone's greatest hope. Also, understand that with the scale of work we are charged to do, don't let perfect get in the way of progress. We may never witness such structural changes in our lifetime, but recognize the foundation we've laid in a long line of contributions that have come before us and paved the way for future generations to one day achieve those same goals. Most importantly, please, please, please take care of yourself to stay in the fight. I'll leave you with this. As we embark on our professional journeys, we'll always be students. I'll look at life not as peaks and valleys, but an ongoing process of learning and mastership. Know that as you leave these hallowed walls, you will not have the answer for everything, and that's okay. But ask the right questions. Stay curious. Be a productive skeptic. Finally, we are not just graduates of the Yale School of Public Health. We are torchbearers of a legacy that stretches back over a century and now join the ranks of the venerated leaders that have emerged from this very institution. The question becomes, what will you do with that torch while you have it? So, as we step forward to receive our diplomas, embrace this moment with gratitude, humility, and a sense of purpose. May our footsteps leave an indelible mark on the path toward a healthier, more equitable world. Congratulations.
Thank you, Kamali. All right, now is the moment you've all been waiting for. This is when we are going to honor you by giving you your diplomas. So we're going to start with our MPH graduates. We're going to ask you to follow the directions of our staff. This is your last task as a student, I promise. Follow the directions of our staff to proceed to the stage in your lines. When your name is called, we're going to have you cross in front of the podium to receive your diploma from me. Then, as you go down, a representative of the Yale School of Public Health Alumni Association, which you are all about to be part of, Kathy Fox, she will provide you with your alumni pin so you can get some nice Yale flair as you exit the stage. Individual photos will be taken of each student as they receive their diplomas. These photos and all the rest that we've taken over the course of this weekend will be made available to students and family for free later this week, along with a video of this ceremony. Thus, we ask guests, I know as a parent myself how much you want to be the one to get the picture on your cell phone camera. Please trust us to get great professional photos. Don't take photos in the aisles because it's just going to make it all complicated and keep us all warm a little bit longer. So thank you, parents, guests, for letting us take the pictures. With that, it is now my immense pleasure to introduce Dr. Mayur Desai, Director of the Advanced Professional Program, who will begin introducing the candidates for the Master of Public Health degree in the AP program. Mayur, there we are. Watch me try to follow directions now.
Okay. Jeffrey Boateng. Carla Isabel Bohe. Oh, Jeffrey. Oh, oh. Helen DeFore. Jinsey George. Rohini Ghosh. Joseph Kofi Selassie Krebagesi. Kriti Lata Krishnan. Kenneth Kwan Lam. Stellan Lee. Abigail McDonald. Adriana Morales Miranda. Miriam Mubarak Gabrian. Lucas O'Brien. Eunice Park. Matthew Charles Parker. Shreya Rajshekar. Michelle Rodriguez Aguayo. Charlotte Sagan. Sylvia Tawia Ishan. Grayson Evangelos Warwick. It is now my pleasure to introduce Dr. Xuanggu Ma, Chair of the Department of Biostatistics, who will introduce candidates for the Master of Public Health degree in that program.
Yu Jia Cai. Yun Xiaoduan. Zhen Fan. Mei Rui Li. Qian Li. Xi Zhu Liu. Yixuan Liu. Yunhe Liu. Yuping Liu. Jenny Lu. Hao Chenqiao. Kate Susanna Rogers. Yu Xinshen. Han Shi. Jun Cong Shi. He Yu Wang. Wen Xin Wang. Qi Yu Wang. Ya Wang. Ya Qi Wang. Hui Qi Wen. Jia Qianxu. Ke Xu. Jia Ruiyan. 江南义、横超柱、接住。It's now my pleasure to introduce Dr. Judy Lickman, Chair of the Department of Chronic Disease Epidemiology, who will introduce the candidates for the Master of Public Health degree in that program. Judy?
All right, ready? Fayed Alam. Haley Allcroft. Victor Amana. NC Tsai. Jiawen Chen. Tianzu Feng. Gal Hodish. Wani Huang. Li Sing Kong. I think she's here. Liza Koshi. Yi Li. Victoria McClare. Yunan Mei. Gabriela Mendoza Cueva. Sichan Nu. Oyenlola Obatalu. Ianalua Priscilla Odele. Peru Pan. Syra Prushanth. Ana Karina Raigosa Cortez. Sadia Rayman Safwi. Xiao Yasun. Pei Wang. Qin Wang. Ruqiao Wang. Yan Wu. Qianyi Xu. Lainey Zhang. Ling Sao Zhang. And William Zhang. It is now my pleasure to introduce Dr. Vasilis Vasiliou, Chair of the Department of Environmental Health Sciences, who will introduce the candidates for the Master of Public Health degree in that program. Thank you.
Thank you, Judith. Gabriela Maria Crivelli. Hazel Ann Fajardo. Ashley Michelle Gray. Rihanna Suzanne Harker. Claire Willie Laughlin. Lin Shuo Lu. Cynthia Jogi Miles. Charles Minicucci. Marla Joy Minkoff. Amina Mutalib. Sofia Mara Tacek. Yunwe Shi. Nicole Christine Limnigan Smith. Anna Carol Faith Stuffer. Caroline Elise Sutton. Zhaoqing Zhang. Thank you, EHS. It's now my pleasure to call Dr. Michael Capello, Chair of the Department of Epidemiology and Microbial Diseases, who will introduce the candidates for the Master of Public Health degree in that program. Michael.
Ellie Cragen Borgicos. Becca Chaucy. Abigail Bell Chung. Nicole Del Castillo. Tejasvini Dormapuri Vachaspati. Julia Danielle Elman. Laura Fitch. Sophie Jenna Jorgis. Amanda Lauren Glatter. Alexis Godoy. Olivia Dawn Gott. Omar Guerrero. Savannah Henry. Jose Marco Antonio Hernandez. Sarah Hinderstein. Sydney Marie Jones. Priya Kosana. Vanessa Lam Ip Man. Xiaowei Li. Sophie Zisha Lacoste. Caitlin Moray. Nithya Narayanan. Vanessa Nunez. Erin Larissa Pollock. Haley Schultz. Caitlin Soden. Yom Fiseha Tawal Demeden. Beth Warren. Catherine Grace Shylack Wenger. It is now my pleasure to introduce Dr. Martin Klein, Director of the Executive MPH Program, who will introduce the candidates for the Master of Public Health degree in that program.
With joy and great respect, I call you up. Muhammad al-Musalmani. Centers J. Yosef al-Hashami. Daniel Anderson. Lady Anderson. Nicholas Isaac Arledge. Jenna Butner. Nathan Carroll. Jenny Chang. Didier Shukran. Kenneth Antonio Colon. Kimberly Jo Daviscourt. Lauren De Benedetto. Joan Duggan. Nancy Izquierdo Ifobi. Daniel Fitzgerald. Jonathan James Franz. Vadim Gelman. Kyle Jeffrey Hampson. Jennifer Elizabeth Hauser. Thomas Edgar Hudson. Jana Jansen. Judson Katz. Parul Kodan. Sarada Leavenworth. Carol Elizabeth Lucy. Ame Lufuwabu and company. Zachary Lynch. Tatiana Mello. Hannah Mestel. Thank you. Tara Parker Pope. Sean Patterson. Mufti Mushfiqur Rahman. Ashley Nicole Reynolds Marshall. Saranya Sethuraman. Thejal Shrikumar. Christopher Stevenson. Leah Christine Werner. Mengfei Yang. It is now my pleasure to introduce Dr. Howard Foreman, Director of the Healthcare Management Program, who will introduce the candidates for the Master of Public Health degree in that program.
Adwa DFA Entry. Michaela Barker. Barry Rebecca Berger. Rodrigo Bravo. Ru Chen. Larissa Chia. Kamali Flora. Tola Michael Badamosi. Annie G. Caroline Guillot. Jillian Hornbeck. Toshinari Ishikawa. Matthew Caspi. Akio Kato. Hon Jin Ashley Kim. Edwin Lee. Julianne Lee. Sihan Liao. Wei Sin Ji Lu. Elise Lynch. Mustafa Mart Mayton. Carolyn Rose Perry. Chen Ravi Prang. Bhargav Ramesh. James Michael Riley. Blake Edward Robertson. Gianna Gloria Sarrazin. Rabia Sheikh. Eileen Shirley. Oluwatobi Shitabe. Anthony Silverstrone. Sylvia Yudi Wang. Chloe Yang. Flora Chow. Yuan Yuan Zhou. It is now my pleasure to introduce Dr. Jason Hockenberry, Chair of the Health Policy Program, who will introduce the candidates for the Master of Public Health degree in that program.
Thanks, Howie. Emmanuel Ayapong. Justina Bruler. Coco Cho. Du Li Yu. Eliza Elliott. Oishi Goswami. Catherine Hall. Haley Henry. Hui Hui Wong. Wenxin Zhang. Sandhya Kumar. James Lawrence. Eric Scott Lynn. Sean McMillan. Juliana McVeigh. Anna Moon. Hey. Ellery Claire Niederer. Claudia Pagnosi Schwam. Kylie Ann Cogswell Pratt. Amrit Gar Santu. Hannah Jean Scott. Perry Sosensky. Hannah Stiles. Dolma Searing. Harley Brianna Webley. It's now my pleasure to introduce Dr. Trace Kershaw, Chair of the Department of Social and Behavioral Sciences, who will introduce the candidates for the Master of Public Health degree in that program.
All right, SBS, let's do this. Josiane Momokunde Alex. Devin Trevion Brown. Nicola Davis. Shivani Duyal. Wyatt Austin Deal. Rachel Diaz. Sophie Elizabeth Edelstein. Caroline Elizabeth Firmadal. Dara Elizabeth Gleason. Pia Gabrielle Kumagan Gorme. Andrea Ona Groza. Yunka Gu. Tarini Gupta. Laiba Hamid Hassan. Mohammed Isa Bamami. Hannah James. Mansoura Kermani. Caitlin Kostakis. Rebecca Yinbei Lee. Amelia Lowry. Camilla Luker. Emily Jane Morrison. Shayna Naranjo. Nak Hong Nguyen. Azinwa Aswaha. Sydney Marie Perlato. Stephen Harris Pianon. Mac Reuter. Jose Danielle Rodriguez. Aaliyah Roxana Romero. Natalia Rovello Velasquez. Kaylee Rose Seiler. Yihan Shah. Madeline Sorensen. Karena Kinsella Thomas. Paige Chun Lai Tup. Samuel Abechu. Naomi Lee Verne. Mafalda von Elvensleben. Pei Wang. Yasmin Wardman. Mingyang Zhang. Now it's my pleasure to reintroduce Stephen Ma, Chair of Biostatistics, who will introduce the candidates for Masters of Science in Public Health.
Palatito adipojo. Jingnan Bai. Jin Xuanbian. Zhi Yuan Cao. Yu Chen Chang. Hao Ting Chen. Meng Fan Chen. Shuang Rui Chen. Wan Jing Chen. Yining Chen. Yongzhuo Chen. Zihan Chen. Huang Rui Chu. Eric Cummings, 于飞邓、辛一娣、郎定、Kenny Doe、岳雷富、Cindy Gao、于通个、施延国、瑞泽汉、秦汉虎、何元煌、戚玉煌、贾成基、子清基、回家、于汉进、Mahima Kaur、陈希丽、杭丽、文宣丽、严希丽、伊丽、易宣亮、易汉六、金家梦、易梦妙、 Polina Ovinchinkova, Ying Xue Pan, Wei Pang, Vidi Patel, Zian Paswala, Xin Yue Qie, Tian Fang Shao, Belinda Wang, Cheng Xi Wang, Hui Ren Wang, Jia Yi Wang, Ke Xin Wang, Shu Rui Wang, Yi Chong Wang, Jia Wei, Chu Han Wu, Qi Fan Wu, Yi Lun Wu, Yi Xuan Wu, Zhen Wu, Hui Yixiong, Bai Jiaxu, Yun Yang, An Jie Yao, Ceng Yizheng, Ding Weizhan, Bo Zhang, Runqiu Zhang, 于正章、宁坤洲、新宇宙、高地柱、嘉诚柱、四哲座、
All right, you guys, you've done it. So I'm going to talk for just 1 minute more. I do want to take a moment to acknowledge our 29 YSPH students who have received their PhD degrees from the Graduate Schools of Arts and Sciences. We hooded them yesterday morning. They couldn't be here for the most part, but I want to give them a big round of applause because those PhD degrees are so meaningful. To the class of 2024, the degrees you each have been awarded today are a testament to both your hard work, your passion for public health, and your tremendous potential to change the world. Families and friends, thank you for all the support that made it possible for them to be here today. My colleagues, faculty, staff, for encouraging and inspiring these students in their time at Yale. And I have to give a big thank you to our Student Affairs team, who's worked tirelessly to produce this event. Associate Dean Frank Grasso, Director of Student Affairs and Registrar Stacy Tuttle, and their entire team, Stacy, and of course our colleagues in the Office of Public Health Practice and in the Office of the Dean. Thank you. Now, class of 2024, please stand. And this is where you get to throw the hat if you want, or don't if you want to keep it. Congratulations on your commencement. Move that tassel over to the other side. Go change the world, you guys. Thank you. Guests, please remain in your seats until our amazing graduates have departed. Thank you.